or not. But let's start with where we started, where I started this morning. Tomorrow is World AIDS Day, and we continue to hear that AIDS and HIV hits hardest among black people, among Latino people, and among young people, and more recently, women. Why, and what do we do about it? You want to start, Dr. Brooks?
Certainly. Your information is accurate. HIV, AIDS is the #1 killer of African Americans 25 to 44. It's a preventable condition, so it is really relevant that we focus on it. I think that we need to understand that it is how it is transmitted. You mentioned information saying that X number of thousands cases have been diagnosed in those 13 to 25 years of age, and they don't even know they have it. How did they get it? They get it by doing what 13 to 25-year-olds do, most likely sex in this case, although you can also get it from blood transfusions, very rarely,
using needles.
Or using needles.
Yeah.
So a key aspect of that concept is they don't know they have it. The way you know you have it is to get tested. So we recommend testing everyone 13 years and older for HIV.
And of course, in World AIDS Day, there's lots of free testing all around. If you want to get it done and you don't have any money, that can be done. Thabiti, I know you have a totally different take on this.
I totally do. When you look at what they're calling AIDS, there's 12 different definitions around the world on what AIDS really is. And quite as is believed, there's no scientific proof that HIV causes AIDS. But this is something that you got rappers, you got actors repeating over and over again. And this is not something that I'm saying. You got doctors saying it. You got Dr. Duesberg, the one who isolates the first cancer gene. He says HIV does not cause AIDS. He said whenever he's isolated it, it doesn't do anything. It doesn't replicate. It's not destroying other cells. And even Dr. Wilner, same thing. He says the #1 cause of AIDS is AIDS medication. Our people are being over-medicated, and no one's talking about building the immune system. We're talking about toxic medications. Now, we're about to have another AIDS annual celebration, as they call it. But what happens is during this time, all they talk about is different drugs that they want to try out on people of color. And this is why I have a problem with it. As far as the medical literature, they're telling us that AIDS started in Africa. AIDS did not come from Africa, it was brought to Africa.
Okay, I know you have a lot to say, so I want you to take a deep breath, and we're going to take on these things one or two at a time, because it's a lot of different topics that you just brought up there. And you know, we may not get to all of it today, but in the interest of not being totally confused and flabbergasted, try to take them on a little bit at a time.
Sounds good.
So let's start where you started. You say there's all these different things that go under the category of AIDS or HIV, and that we don't know everything. Well, clearly we don't, because there's no cure, right? But number one, we know that those courses of drugs that people are taking, although they have lots of side effects, do keep people alive. I mean, before, people died from what we're calling AIDS or HIV, whatever those 23 things were. People were dying from it. Now people are living.
Well, there's people that's been living on holistic regimens, people that I even know that got that diagnosis many years ago. So I don't think the medications is actually keeping them alive. Their immune system is keeping them alive. They've got more blood transfusions when they go through some of these medication regimens. So there's a lot more attention being focused on their health. In reference to the medications you're talking about, I was looking at some of the medications just over the weekend. I mean, you're talking about breathing difficulties, tightness of the chest, you know, I mean, blood in the urine.
Okay.
I mean, these things are I really go with the
herbs. You know, I well know about this, because I actually have a number of friends that have HIV and AIDS, and some that have died, including, you know, my beloved stepfather, who I was very, very close with. And so we can say there's 23 different things or 100 different things, but when we look at what's happening to folks, it seems to be similar.
Well, if I may speak, Dominique, first of all, there is no controversy as to what causes the medical condition of AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. It's caused by HIV virus. There are two types, types 1 and type 2. Primarily in the United States, we see type 1. In West Africa, we see type 2. So this is clear. When you diagnose someone with it, you can actually measure the amount of virus in their system. You can measure how well they're doing with their treatment and their overall quality of life based on how much virus is in their bloodstream. So that's clear.
I totally disagree with that. You're not even testing. You're just testing antibodies. You're not actually seeing the virus destroying other cells.
And for the purposes of clarity, an antibody is a reaction to something in the body as opposed to an actual disease. Right?
That's correct. An antibody reacts to something that is a foreign substance that the body determines doesn't need to be there. But no, you also get what's called the viral load, which actually measures the copies of the HIV virus. And when you have a large number of those viruses in your bloodstream, you're sicker. And the goal is to reduce the virus that's in your bloodstream down to essentially zero and not detectable. And those patients that have a low viral load, as it's called, tend to do better, are healthier, more active, have more energy, don't get infections as much. And this is the standard of care in terms of how we manage an HIV patient.
And that's totally opposite. I mean, when you look at the fact, like I said before, when the virus has been isolated, it's not doing anything. It's in a dormant state. It has not even been observed destroying other cells. Where in the lab have you seen that? What study can you tell me that's been done? That has not been done.
Here's the thing, Thabiti. We know people are sick. We know that we're seeing a lot of the same symptoms and syndromes with these people who are sick. And so does it really make sense for us to sit here and argue about whether it's caused by one virus or 23 viruses when we need to be saving lives?
Well, I like to come to that conclusion, but I think we have to know where things are coming from if we're going to see how we're going to be able to treat this. Now, if you've got doctors that have taught at Harvard, you got doctors that have taught at some of your top schools in this nation, if they're telling you that HIV does not cause AIDS, and if that is true, then look at all these people that are on AIDS medications. Do they have lawsuits? That's one of their main issues. That's the reason why the medical field will never say HIV does not cause AIDS.
Let me ask you, Dr. Brooks. Wait, go ahead and respond, then I'll ask you.
Well, the way I look at it is more simple than that. You have a patient that has a condition, and with HIV, they're generally not that sick because it hasn't actually totally destroyed their immune system. Yes, the way the virus works is actually targets your immune system, and it kills the cells in your body that are part of your immune system. That's why your immune system gets weak. Then when you treat the patients with these medications, the patients improve. They're healthier. All medications have side effects, so you're going to have some side effects. But if left untreated, patients where you do blood tests and you find they have HIV, if untreated, it'll progress to AIDS and they will die. So I just don't look at it from a philosophical perspective. I look at it from a medical perspective and wanting to help people to live longer.
Okay, so here's my question. When you're talking about a medical perspective and wanting people to live longer, when we talk about drugs, I know a responsible doctor wants to choose those with the fewest side effects, no side effects at all, the fewest drugs possible. Is enough emphasis being placed on healthy immune systems, on total health, on prevention? Because obviously in this country we have the habit of going for the magic bullet, going for the pill, the medication. And, healthy lifestyles make a big difference in preventing HIV and AIDS, right?
So things like what Coach E recommends focusing on, I endorse like 100%. True, it's excellent to have good nutrition, good communication, good mental health. I do believe that will allow you to better fend off this particular infection, but that in and of itself is not the answer. I also believe, and I believed it to be, but probably be a naturalist in terms of these concepts of herbs and health and nutrition and mindfulness, that type of approach. I agree with that also. It's a complementary approach. You would do those things in addition to whatever treatments that your infectious disease doctor, whoever the doctor is that's managing your HIV condition, says. So they all work together.
But what about this approach of like, okay, I have HIV, now I need to step up and strengthen my immune system because everyone agrees that HIV attacks the immune system. What about, taking those vitamins, those herbs, those lifestyle practices, stress management that we know boost the immune system?
Right. I think that's a good approach. I think that we have to be a little cautious about the thoughts that we have that we can, quote unquote, boost our immune system. There are some things I think that can overall add to your general health But the ability to technically, if you will, boost your immune system, the jury is still somewhat out on that. My approach to that is do no harm. In other words, vitamins, I'm fine with people taking vitamins. I'm more focused, in my opinion, on eating right. If you eat right, then you get a lot of the vitamins that you need in the first place. But again, the bottom line is, if you've crossed the line, if you're HIV positive, or if you have full-blown AIDS, in addition to those activities we mentioned, you must, in my opinion, and in the opinion of the medical community, and there, if I'm hearing Thabiti say there's some controversy, maybe 1 or 2% of the medical community, but 98% of the medical community is clear on the fact that HIV is real. It's caused by a particular virus. If untreated, you will die from it. It attacks the immune system. It takes medications to cure it. You have to monitor them for certain infections, etc. I mean, that's just basic medicine.
That's what you're supposed to say as a doctor that's being funded by pharmaceutical industry. So you're supposed to say that you're going to die from it. There's no relief. My thing is this: how can you? I believe it's a man-made. You know, anything that is man-made, there's no way in the world I believe that God will allow anything man-made to succeed. And so that's why I have faith that it can be healed. But in reference to what he's saying about these medications helping people, they're not. What they're doing, if you look at their studies, they're tricking you, because what they're doing is they're saying, well, with this combination of medications, this person lasted 1 year. With this other different combination of medications, they lasted 3 years. So now there's a 50% increase in life. They use these trickery situations.
Okay, well, let's move away from trickery into real life. I have 2 friends. They're cousins. Mm-hmm. Both of them were HIV positive. One of them did not take the medication. He subscribed to a diet of prayer. Mm-hmm. And he passed away. Okay. And he rests in peace. His cousin, who is also my dear friend, is still with us. My friend who died 14 years ago. Mm-hmm. My other friend is still alive. Okay. And working.
Okay.
And you know, I'm not a big advocate of drugs, but you don't have to be a rocket scientist.
Well, let me say this: there was a women at risk group.
And by the way, the one that's taking the medication is also praying. So.
Oh, okay. There was a group in 1992 called Women at Risk, and there was 11 of them. And out of those 11, after a year and a half in that group, 8 of them died. There was 3 that were still alive, and lasted till about another 15 years. What they had in common is all of them did not take the medications, the one that survived. Because if you see how those medications affect the immune system, I was telling you before, the blood in the urine and the tightness of the chest and the yellowing of the eyes and all of these serious side effects, you can see how there's no way in the world that's going to improve.